Strokes. Strokes, a cerebral vascular accident. I'm not sure why they call it an accident. It's not an accident. In any case, is the leading cause of disability in the United States. There are two types of strokes. A vessel in the brain is bleeding, and that happens about 13% of the time. 87% of the time, there is a blockage in a vessel in the brain, a blood clot. So we talked a couple different times about these blood clots. Where do they come from? Why do you have blood clots in your body?
Cholesterol?
Okay, it could be a piece of that has broken off. Good, good. Blood clots come from a variety of different illnesses that we have, a lot of different conditions we have, obesity, lack of exercise, crossing your legs. One of the probably the most common is irregular heartbeat, called atrial fibrillation. In itself is a benign problem. Your heart beats irregularly. But if your heart beats irregularly, blood has a tendency to swirl or pool, and those platelets stick together and form blood clots. Certain diseases, sickle cell and other diseases promote more blood clots. But again, lack of exercise, being in bed and not moving, all these things promote blood clots. But in any case, 87% of strokes is a blockage in a vessel in the brain. It blocks blood from going to the brain. The brain is very sensitive. It's very intricate. If the brain doesn't receive blood and oxygen in very short periods of time, it will affect a part of the body. All parts of your body are controlled by your brain. Your speech, your memory, your eyesight, your hearing, all your muscle movements are all controlled by your brain. So it all depends on which part of the brain is not receiving blood and oxygen to determine what part of the body will be affected. Usually very sudden onset, and not usually a lot of pain. A person just can't move their arm, or they're confused. The American Heart Association has a generic test. And I'll preface this by saying I'm not completely fond of it, but I'll tell you what it is. It's called FAST. F-A-S-T. FAST. Have the person smile. If they cannot smile normally, they could be having a stroke. Document the time and call 911. A is for arms. Have them hold both their arms out straight in front of them. If one arm drifts or they can't lift it, they could be having a stroke. Document the time and call 911. S is for speech. Have them say a simple sentence. It's a sunny day in Naples. If they can't say that, document the time and call 911. T is for time. Time is critically important to determine whether medication will be delivered. More importantly, whether invasive surgery will be done. Yeah, last time I saw my husband normal was when we went to bed last night at 8 o'clock. That's very important for the doctors to know. Or, yeah, it just happened 5 minutes ago. We were having breakfast and he suddenly slumped over in the chair. Why am I not fond of this test? Because a person can have a stroke and pass this test. I'll give you an example. A bleed in the brain. They can have the worst unexplained thunderclap headache of their life and still pass the test. Eyesight, loss of vision, and some other neurological deficits that they could still pass the test and still be having a stroke. So bottom line is, any neurological deficit that's not normal for them, document the time and call 911. So these are specialty cases. Once again, we have a stroke scale we use to determine the severity of the stroke and determine whether to go to a primary stroke facility or a comprehensive stroke facility.
And then there's something given in ER if it's soon enough or the right kind. What is that?
Yeah, they basically give a strong clot busting medication. If they determine, they do the head scan first. That's why we don't want to give aspirin. Okay. Do not give aspirin to stroke patients because you don't know whether it's bleeding in the brain or a blockage in the brain. So do not give aspirin to stroke victims. But then after they do the scan, they determine it's a blockage. A strong clot-busting medication is given to try and dissolve the clot in the brain. Then from there, they can go in to the brain with different types of tools, sometimes even break up the clot, grab it and pull it out, dissolve it, squirt some of that medicine on it and dissolve it. Wide variety of things they can do through invasive surgery. Yes, ma'am.
Just by reasonable deduction, if someone is having a stroke, if they can't say a sentence and they can't smile, then they wouldn't be able to eat aspirin, would they?
Right, but we don't want to give aspirin anyway.
Right.
You're right, yeah.
What I'm saying is that would be logical that they wouldn't
Sure.
be able to.
And that's a very good point. We never want to put something in someone's mouth if they're not able to swallow or speak normally. Good point. Yes, ma'am.
Give them something else?
No, sir. No, nothing to eat or drink if someone's having a stroke. We never want to put anything in their stomach. They could gag on it. They may not have a gag reflex. They could aspirate it. Never put anything in someone's mouth.
Call 911.
Please.
So you were speaking of the 3 hospitals that pertain to the stroke victims, and then there was one in particular that was for a higher level of stroke. So if your loved one has had a stroke in the past and has issues already with disability from a prior stroke, and now supposedly they're having another large stroke that you know is a stroke, do you tell the driver, I want to go to the higher hospital, or do they make the call, or how does that work?
Well, we go by that scale, and it's a chart. It's a stroke assessment scale that the neurosurgeons and the local medical director have to determine if they have these symptoms and the criteria, they are best served by a comprehensive stroke center.
What is comprehensive?
It's a higher level of stroke center where they can do invasive surgery.
So that
So
would
who
be
makes that
Pine Ridge.
call, and then
Pine
what-
Ridge.
Right. But since timing is so important, if you lived in Park Shore, or I'm sorry, Gulf Shore, and you didn't have the comprehensive signs and symptoms, it would be inappropriate for us to bypass NCH downtown and go to a hospital further away when NCH can treat your mild stroke, I'm not sure how to describe it, a lesser severity stroke simply with a medication, and you probably don't need the surgery. So bypassing a facility that has that capability to go to another hospital.
So who makes that judgment call, the EMS or the
Yes,
hospital?
EMS.
EMS, when they arrive, they say, oh my God, this is a major stroke, we're going straight up to Pine Ridge? Or they say, this is just a minor stroke, we're going
Right.
to pay it and see.
That's putting it kind of mildly. And the other key important point is, when did the symptoms begin? If the symptoms began 10 hours ago, a comprehensive center is needed for that. If they were a short time ago, it may be a primary center. So
Will
a lot
the
of
primary center address the issue the same as the comprehensive? I mean,
initially, yes.
initially they'll give it the heparin, and they'll try to do the clot busting drug and all that stuff.
Right.
And then if it's something more severe, they'll transport them up there?
Yes. It depends, and sometimes they can even do the surgery here, depending on what it is and how long it's been. We want to get the patient to the hospital, the right hospital, the first time. I promise you. So we're looking at that chart and trying to make that decision. But it's sometimes difficult. It certainly is. But they're trying to make the best decision they can. Yes, sir.
It sounds as if you go to NCH much more than you do to either of the physicians.
I'm saying that name more often than I am anything else, and that's probably true. And I don't remember the numbers off the top of my head. I know that Collier Boulevard receives the least amount of patients from us. NCH is the most. This is all patients, not just stroke patients. And then Pine Ridge and North Naples, I think, are somewhere in the middle. I don't remember which one is second and third. So yes, NCH downtown is the most common. Collier Boulevard is the least common, and somewhere in between are the other two. And I think most of that, to be honest with you, NCH has been here for, I don't know how many years, 40, 50 years, whatever it is. And people who are established, that's where they establish to. And I'm not saying NCH is a better hospital, don't get me wrong. Just people are established there.